Good evening and welcome to tonight's webinar, Palliative Parenting, a new approach to parenting success. For those of you who don't know me, my name is Elizabeth Errico. I'm the Executive Director of the Children's Mental Health Resource Center, and our mission is to provide guidance and resources for early identification and management of mood disorders such as bipolar disorder and its newly identified phenotype dubbed fear of harm. We fulfill this mission through a series of programs and services that are offered to families as well as to mental and physical health care providers. The first of which is our palliative parenting class. This is a class that we teach in small face-to-face groups, as well as through an on-demand self-guided video course that you can access online through our website. And this course is designed to empower parents to improve the quality of life for themselves, their children, and their whole families through understanding this new approach to parenting that we are going to talk to you about tonight. We also have other programs and services, including the CMHRC Toolkit, which is a symptom tracking web app that was designed for parents to use to help understand the symptom presentation that they see in their children. We have a book club that is open to families as well as to providers, where we cover topics related to children's mental health and mood disorders. We have professional development discussion groups for an interdisciplinary team of mental and physical health care providers to understand mental illness as it presents in children. And we have our Wayfinder custom support services, where we work with providers and families on understanding the diagnostic complexities that go along with mental illness and mental health disorders in the pediatric population, as well as working with families and schools around ensuring that children get the support and accommodations they need for their mental health conditions when they're at school. We also provide transition support when families are changing providers, and community mental health advocacy for help advocating for your child and their needs when you are in your community. Tonight, I am joined by three people to talk with us about palliative parenting. I'm joined by Jennifer Sevick, who is CMHRC's clinical director, Lisa LeMay, who is a licensed marriage and family therapist, and Danielle Ott, who is a parent and child advocate who works with us here at CMHRC. As we go through the event this evening, please feel free to add your questions and comments into the Q&A box. We'll be monitoring it as we go and integrating your questions as we can. So please feel free to open up that Q&A and put your questions in there. Now, I want to welcome Lisa, Danielle, Jennifer. Thank you so much for being with us tonight. I want to start off by talking about the word palliate, because a lot of folks seem to associate the word with things that are associated with end-of-life care. And we are using the term palliative differently. So Jen, why don't you get us started off by talking about what palliate means in the context of talking about parenting?
Yeah, so palliation, the concept is to ease or reduce symptoms and to really provide comfort care and quality of life in any kind of system. So whether it's a medical system or within families or within a community, it's all about just living the best that you can and using the approaches that make sense to you and your family.
And I want to point out that we termed this approach palliative parenting because that's exactly what we realized when we were working with one another over the last few years and talking about and teaching this approach in small groups, is that we were all as parents coming together and recognizing that our children have conditions that make it so that no matter what setting we're in, as you mentioned, whether we're talking about school, whether we're talking about medical care, whether we're talking about discipline or family interactions, activities, that we're really always making choices around what the quality of life for our children is and what we can do to facilitate easing their symptoms, reducing their intensity, reducing their frequency, and that we really sort of as a community came together to realize that what we were doing was palliative in regards to treating our children with the respect that they deserved, and in turn getting them the accommodations and getting their needs met, which they also deserve. Um, so, Jen, let's talk for a minute about, palliative parenting and our definition of it, which you helped us design.
Yeah, so with regards to the palliative approach, parents were finding that honestly, the traditional models of parenting, when they were browsing bookstores, when they were going to therapists or doctor's office, school counselors, all of those suggestions from family members, friends, while meant with love and kindness, really weren't very helpful or very useful. And the things that they found were helpful often were things that other people considered maybe enabling, or potentially not looking at the future and down the road, when actually it was just the opposite. What parents found is that by easing these symptoms and choosing different approaches, choosing to think outside the box, they found that over time, their children's symptoms of mental illness were being reduced, that intensity that they were experiencing, their child was experiencing, was eased over time, and that frequency between episodes was diminishing. So while it may not fix or cure the disorder that your child is living with, what they found is overall peace and contentment and really confidence in their ability to move forward as parents.
So, Lisa, I want to invite you to comment on this sort of last phrase that we have here, which is knowing that behavior change will follow. Jen alluded to the fact that a lot of the popular parenting paradigms focus on this idea that as parents, it's our job to mold behavior. And that we're supposed to be in all moments teaching our children how to behave, and that's not really the approach that we take with palliative parenting, and that we have faith knowing that behavior change will follow. Can you talk a little bit more about that idea?
Sure, be happy to. So, what we've learned in working with kids that have mental health challenges is that oftentimes that they are not fully in control of their behavior. What we're seeing that we're labeling as behavior is actually sometimes symptoms of the mental health condition, and that are beyond their control. And so it makes no sense to ask those children to change something that they don't have any control over. So it makes no sense then to have a parenting style that sole purpose is an attempt to change something that the child is not able to change. So instead, we look at tending to the symptoms and improving the symptoms and getting the children the help and support that they need. And as they improve, their symptoms improve, more and more things do come underneath their control, that they are able to make choices and adjust things. And then when they reach this more empowered place, then they naturally start making choices that do help their behavior change and improve. But that we have to put first things first, and that focusing just on behavior and changing behavior as the primary goal leaves both the parent and the child very, very frustrated.
I love how you lay that out, that it's that we expect the sort of linear progression of parent teaches, child learns, child's behavior changes, and that what we're really talking about is sort of reordering that and prioritizing supporting the child and helping them reduce that active symptom in order to make them available to learn new behaviors later down the line.
Absolutely. I think kids want to behave. They want to do the right thing. And so if they are able to, they will. And so if they are not behaving, that there's typically a reason that is happening. And palliative parenting, instead of setting up things to try and coerce the child into behaving, either through positive coercion, like a sticker chart or some sort of behavior management plan, or some negative coercion, like some punishment or some consequences, that those things don't work if it's not within the child's control. And so we again have to go back to what is the child able to do in this moment. And it is our job as parents in this palliative parenting approach to be the detectives, to really learn our child, become the expert on our child, and to understand what is happening for our child. And when we understand what's happening for our child, then we can ask them to do things that are within their capability at any given moment.
Absolutely. And so when we talk about changing our mindset as parents and using our relationship with our children as the tool for making long-term change for them in their lives, we really have to start out by looking at the fact that as parents, it is up to us to make the change that we want to see for our children. And so we break down palliative parenting into three primary pillars. There's acceptance, respect, and community. And we're going to take a few minutes to sort of go through and explain what each of the principles underneath these pillars are. And I'm hoping that Jen, can you start off by explaining to us why we start with the idea of acceptance?
Yeah, it's hard for parents to wrap their mind around that their children live with this illness that's going to impact every area of functioning in their life. And so the first thing we have to be able to understand is that our children do indeed live with an illness, a medical condition, and that we also need to parent them differently because they really do have different needs. And that's okay that their needs are different from their siblings or from our neighbors or from other students in their classroom. And so we can, once we reach that point where we accept, okay, they live with a medical condition, we can let go of any preconceived expectations that we've either placed on ourselves as parents or placed on our children about where we think they need to be developmentally. And we can come up with more realistic expectations for ourselves as parents, and to be able to really observe our children for what they need. But we also understand that we really can't shield our children, unfortunately, from all the pain that they're going to encounter in this world. But what we can do is we can be their soft place to land, and we can also be their guide and their role model and their biggest advocate as well. And so we also understand that we make mistakes, all of us do. And even when we understand this illness, even when we understand how it impacts our children and the challenges that they live with, we're still going to make mistakes. It happens. And we can forgive ourselves and we can try and do things differently the next time. And that's okay too.
And I want to bring in a comment that we've gotten in the Q&A from someone who's asking about whether or not this approach applies to young adults, late teens, 19, 20-year-olds. And we would say yes. Absolutely. Because at the core of palliative parenting is the idea that our relationship with our children is the most important tool that we have in our parenting toolbox. And that when we are able to accept our children for who they are, what strengths they have, as well as what limitations they have, we're then in a position to empower them at any age to be the best possible version of themselves that they can be, to care about themselves, to respect themselves, to take care of themselves, not because it is some sort of externally imposed idea, but it is because of the degree to which we value them and which they can then in turn value themselves. And being able to take ourselves as parents out of the mindset that we need to fix our children, out of the mindset that we need to find a cure for them, isn't about giving up. It's about accepting and meeting our children where they are and giving them the support that they need in order to be able to achieve the things that matter to them in life. And that doesn't stop at any age. It doesn't start at any age. It's really what we're doing as parents from the day they're born and for the rest of our relationship with them. And Lisa, you use a phrase that I love when you talk about prioritizing your relationship with your child above everything else. Can you talk a little bit about that and what that means?
Yes, I have found this to be the most important thing for me as a parent. It's the thing long before I ever met these folks and we ever realized we were all doing this, a parenting approach that didn't have a name yet. This was the thing I knew to be the most true, is that my connection to my child is the most important thing that I need to preserve at all times. And here's why. If my child trusts and knows that I have their back and that I am not going to do things that set them up for failure or ridicule or a sense of betrayal or any of those things, if they're 100% convinced that I'm in their corner, that they can tell me anything, that nothing that they can do or say is going to make me go away or make me love them less, that then if I've got that trust, that means that they want to hear what I have to say, that they want to do what I am suggesting, that they think it might be the most helpful thing. And so now I am the parent of 3 adult children, and music to my ears is that they'll say, "You're usually right. You're usually right." And they say that because they've learned that they can trust that what I am saying is in their best interest, that I'm not setting them up. And so it is very hard to parent when you don't have this connection, right? Because then you're adversaries. Then the child is trying to do things like deceive you if they think that that you might not see things their way or might not take their opinion into consideration, or if you have competing interests. That you want the child to go to school, the child doesn't want to go to school. And unless you're on the same team, and unless you are cooperating and preserving the connection that you have and deciding together how you're going to get to school that day, if you're adversaries, then that builds into a fight rather than a working relationship. And so I have found it to be the most essential ingredient in my parenting experience.
The next pillar of palliative parenting is respect. And, Danielle, I'm going to ask you to chime in here on respect, because I've heard you speak very eloquently in the past about how your children are human beings first, and that in your house, you all interact with one another as human beings, each of whom has needs, each of whom has emotions, each of whom has moods, and that it's through the respect that you share in your household between parents and children, that you're really respecting the journeys that everybody else is on and finding harmony even in difficult times. And so when we talk about seeing our children as human beings first, Danielle, I'm wondering if you can share something on this.
Yeah, sure. I think the most important thing to kind of piggyback off of what Lisa was saying with the relationship with the child is to also, when we finally understood that they are actually little people, like they're going to be adult people someday. And our job as parents is to get them through the childhood that they have. So another good point is that palliative parenting, while we are talking about it as being useful for children with mental health issues or mood disorders, I also use it with my neurotypical children because it's helpful with them too, to get them through everything. So yeah, we treat our children like they're just people who know a little bit less than us about life. and we respect that they're going to make people choices, they're going to make people mistakes, and they're going to need grace from us to get them through that. And I guess what comes with that is respecting that when our children are symptomatic, that it is not a willful or deliberate behavior that they are trying to exude or show to cause trouble in our house. Like, this is when I know my children need the most help and the most respect and the most calm, collected version of me in the room. So
I love how you describe that, because so many people will think, based on traditional parenting models, that when our children are quote misbehaving, that's when they need us to come down hard on them, to set boundaries, to be strict, to show them what is and is not acceptable. Whereas with palliative parenting, our approach is quite the opposite, that when our children are symptomatic, we recognize, or when our children are quote misbehaving, we recognize it as being symptomatic. And then we meet it with that empathy and the compassion that says, if you are not doing well, that means you need the most help from me. And so instead of coming down with discipline, we come and approach it with empathy of, I understand that you're struggling. I'm here with you. I'm with you. What can I do to help you? How can I help you become regulated again? What do you need from me? And that in that model, what we're doing is we're really teaching them how to take care of themselves, how to help themselves learn how to de-escalate. And in those moments, we are striving for the highest possible quality of life for our kids. And when our kids have high quality of life, so do we as parents, and so do we for our entire family. Now we have a question coming in through the Q&A from someone who's talking about setting safe boundaries for yourself, especially when they say and do hurtful things. When I hear this, I'm hearing you just don't care, or you're not on my side. That's a great question, and I'm going to ask our panelists to answer that. But I'm also going to mention that much of lesson 3 in our palliative parenting course focuses on the idea of how to not take the things that our children do and say when they're symptomatic personally. How we are able to set a boundary with them around how we'll be treated, and to do that with empathy, compassion, and love, and also how to set a boundary for ourselves about what not to take personally when our children are acting out either verbally or physically during those dysregulated times. And Lisa, I'm wondering, I've heard you talk about this before. Can you chime in here with something talking about how we recognize that it's not about us?
Sure. So to the question about how do you set an appropriate boundary? Well, sometimes there's a misconception about boundaries. Is it something that you say that you aren't going to tolerate from another person? And that's incorrect, because we can't ever choose what another person is going to do. We can only choose what we're going to do. And so the boundary that you set has to be something that you're deciding for yourself. How am I going to respond to this? What is it that I am going to do in these types of situations? And so when a child is saying hurtful things like that, The first boundary is the one Elizabeth was just talking about, which is I am boundarying myself as like, I know that that really isn't about me in this moment. That if you're familiar at all with Daniel Siegel's work and about the upstairs brain and the downstairs brain, when a child is uttering things like that, they're in their downstairs brain, they're in their fight flight reflex, right? They're not able to control that. For any of us, child or adult, when we get triggered and when we're not thinking clearly, we sputter all kinds of things that we don't really mean. And so my boundary for myself is, oh, the child is saying those things. They're not using their prefrontal cortex. They are in their downstairs brain. And so the boundary that I am going to set is that I am not going to make any decisions about me or my child in this moment. I got to work on calming this child down, helping this child re-regulate. So, and after the child is regulated, when they've come back to themselves, when the prefrontal cortex is back online, then we can talk. And then we can talk about how it feels for both of us, how it felt for the child to feel so dysregulated and to say those things. I can be curious about their experience of that. How was that for you? What was happening for you? And then I can also share what that was like for me. Yeah, that's kind of hard for me to hear those things. But I hear that that's not really what you meant to be saying at that time. And that kind of empathetic, compassionate, collaborative response engenders a sincere apology from that kid. They don't want to do that. They don't want to say that stuff to you. And so they say sorry very, very naturally. And then a nice repair can happen. And then you're teaching them, right? You're teaching them, you're modeling what to do. You're modeling how, oh, when I'm just, they don't get it like when they're 10, but as they get older and as you've practiced this more and more, when they start to be a teenager and that brain is developing even more, they start to be able to go, I'm dysregulated. I need to regulate. What does mom do with me to help me regulate? And then they try some of those things that you've tried. And so the boundaries are all about, I might even think of them as values. How am I going to parent? How do I want to show up as a parent? What are going to be my guiding principles for how I'm living out my life with this child?
One of the things that I learned from Danielle that I thought was the most valuable was this idea we always say expectations, right? So I expect this to happen. But what Danielle taught me was that it's about demands, that when our child is symptomatic and they can't, we have to lower our demands that we're placing on ourselves and on our children so that they can get to a place where they can regulate.
And I love the fact that both of you have referenced the idea that we are, as parents, also in need of regulation, and that as parents we need to approach how we interact with our children based on the impact that we are going to have on them, both in the short and the long term, and that when we show them respect as human beings, we are establishing groundwork for them to respect us as human beings. And when they aren't, that is a clue that there is something that they're struggling with. That when I hear hurtful things from my child, the thought then becomes, my child is in need, and how do I support them so that when they are regulated again, Lisa, as you pointed out, the repair is genuine. The repair is something that really is a priority for them, because they know that we have their backs. We are in their corner, and we do in fact have their best interest at heart, which leads to something that we go into in depth in the course, is the palliative planning process and how we use respect as the basis for being able to make plans, to prepare, to be proactive in our interactions with our children and their interactions in turn with the world, to ensure their success. And as I said, that is something that we go into in depth in session 5 in both face-to-face class as well as in the on-demand self-guided video course. The last pillar of palliative parenting is community. Jen, can you talk us through these ideas?
Yeah, so our children, they have the ability to make positive contributions in the world. They have a lot of worth. And so our role is that we can advocate on their behalf for awareness and for acceptance and also accommodations across settings and in our communities. And so again, we have to go back to those expectations. So we're honest about what our children's strengths are, what sometimes their limitations can be, and sometimes people consider those weaknesses. But we also know, and we've learned that what our children are capable on any given day can change. And even within a single day, right? So what happens in the morning may be very different from what they are able to do in the afternoon. And that's perfectly okay. And we need to help others in their environment to be aware of that they're trying, and that we can really collaborate and communicate for our children and all of their support systems so that it can help improve their belonging, their sense of belonging, and also their confidence. And we want to share what we've learned with other people, share our knowledge as parents over the years, and also to know and to give other parents hope, because sometimes when you hear that your children lives with something that feels so very big, it may feel unmanageable, except especially when symptoms aren't initially always managed, because you're just trying to get the appropriate plan on board. But we know in our community that these things are manageable and that you as a family can have a really good quality of life, and that you can find your community that can help bolster you and give you support.
You know, Jen, listening to you talk about that, I'm just reminded of our organization's sort of motto, which is "You're not alone. We're here to help." So often families experience tremendous isolation when they are faced with a mental health diagnosis. They don't maybe don't know enough about it. They don't know what sort of at-home treatments are available. They may have a short visit with a psychiatrist who writes a prescription and sends them home with it. And there is that sense that they are sort of stuck by themselves trying to figure out how to navigate this. And that when we are engaging in the palliative parenting approach, what we're really doing is we are breaking down that isolation and saying, I need to have people around me who understand what my life is like and can support me so that my child gets the best possible care and treatment, so that my child and my family and I all have the best possible shot at having long-term positive outcomes. And that as the parent, especially when our children are young, but sometimes when they're older as well, depending upon the degree to which they're able to be independent, that we are sort of the central hub on the wheel. We're the thing that the spokes all come out of. We are helping them coordinate their psychiatric care. We're helping them coordinate their medical care. We are the liaison to the school, explaining what's going to be going on. We are having the IEP meetings, and that we're really acting as an expert in our children, and we're acting as that sort of parent professional who is coordinating all of the pieces of care. And that when we come together to do that, it makes it a little bit easier because we're not doing it alone, that we can have that sense that other people are experiencing the same thing. It's not catastrophic. There is hope. There is a future that is positive and productive, and engaging and fulfilling for our children. And when we are stuck in isolation, we don't have access to that hope. And so, we've all come together, the four of us, in this sense of community, and we facilitate this course in order to increase that community. And so I'm wondering if you could, each of you, if you're comfortable, share a little bit about how you've seen families' journeys change as a result of this coming together and having a community to support you as you face the challenges that your children have. Jen, why don't you start?
All right. Yeah, I know that parents have often been told, well, mental illness in children is rare, and that this is an anomaly that's happening, or sometimes what they know they're experiencing, unfortunately, it's not immediately validated by the professionals in their community. So when they're able to find communities like the Children's Mental Health Resource Center, what they come to realize is that it's not so rare, that they're not an anomaly, that their family isn't weird, and that there is a whole group of people out there who absolutely do get it and understand what they're going through. And they also have other people who have been at this for a while, and so that they can see, wow, look where they are. This is where they said they have shared where they've been. And now I know that there is a path forward. I don't feel like I'm in the dark anymore.
Lisa?
I have seen families, well, parents really feel like finally I can just say how it really is at home. That it sometimes kids with mental illness, their symptoms show up as behaviors that are socially unacceptable. And it's very hard to talk about, and it's very hard to find places where people will be receptive and not judgmental about the parent or the child. And so the kind of community that CMHRC fosters is parents can come as they are, and they can relate their children's stories as they unfold. And there isn't a sense of judgment about that, more a sense of acceptance and knowing and having been there. And as Jen was saying, people enter at different points in their process. And so there are people that at the very beginning of a journey of getting a mental health diagnosis for their child and are bewildered. And then there are some that are right in the thick of it, and there's a lot going on, and there's a lot of medical appointments and therapy appointments and school issues. And then there are those whose kids are a little bit older and who are at a different point in that journey and can offer wisdom and support. And so it has a very inclusive feel and a very, I guess, collaborative. People are able to pitch in and with ideas and support and empathy. There's a lot of empathy. And those things, I think, make a real difference in how people experience this parenting journey, which is challenging enough without a mental health issue on board. So it's really critical that there's some support around that mental health issue.
We have a comment in the Q&A where someone has written, this is so validating. How do I explain to others that this approach is what's best? I find I get a lot of pushback when doing the out-of-the-box things to help my child. Danielle, do you have anything that you want to add to that? I know that you've had a lot of experience talking with families around issues related to school, where there is a lot of pushback from folks who want to take a more disciplinary-oriented approach.
First of all, at least personally, if the pushback isn't coming from my partner, who is the only other parent in this situation, I kind of don't listen to it all that much or give it that much credence, because they don't live in my house, they don't spend time with my children, and they are not responsible for, the outcome of however many years of this it takes to get my child where they are. So I think part of the acceptance piece was to just accept that we have to do what we have to do for our kids, and that some people are going to look at us crazy sometimes, and that's okay. We don't have to internalize that, and we really don't have to let their opinion of us and how we're doing what we're doing that is correct for our children weigh on us. So for me, that realization was kind of the end all be all of explaining to anybody what I'm doing. In terms of advocating for kids at school, there are laws, there are things to protect you, there are things you can do. And sometimes, as in our case, I can really only speak for my case. When those things didn't pan out, we went nuclear and left school. So like palliative parenting is about centering the quality of life for your child and helping them become an adult through a very turbulent childhood that is not anyone's fault. So when we had to take our kid out of school to help him regulate and get back on track, that's what we did. And of course, people were not happy about it. There were grandparents that had a lot to say, friends that I couldn't believe that I would just take him out of school in the middle of the year, a lot of that to contend with. I just didn't care. I don't know how else to put it. I didn't let those things affect me. And I had this conversation with my child. Obviously, he was involved. He was the one who told me, like, I cannot do this anymore. This is not, I can't get up and go to school and do this anymore. We need to try something different. So, okay, we're trying something different. And so in terms of getting people on board with you, hopefully you can get your partner on board. But other than that, I personally, I didn't put a whole lot of weight into what everyone else wanted or thought about what I should be doing with my child to help them.
Danielle, you bring up a good point about partners and being on the same page. And Jen, I think you're the one who once used the expression, some partners are on the same page, some partners aren't even in the same book, right? And so one of the things that we definitely encourage when it comes to palliative parenting is that regardless of who your co-parent is, or what your relationship with your co-parent is, that this is still something that you can both do with your child. And so that's why our face-to-face palliative parenting class is run so that one or two co-parents of the same child can participate in the class together. But Lisa, there was something you wanted to add there, I thought.
Yeah, I was going to say, Danielle's courage and stalwartness notwithstanding, it can be really hard to parent outside the box and to choose things that are non-orthodox and to experience people's disapproval. And that is yet another reason for community, because you can know in your heart of hearts that you're doing the right thing and still to be told over and over again by professionals and other well-meaning people that you're not. It does really help to have a group of people who are like-minded, who have also been in the trenches and have an informed decision that resonates with yours. And that really helps you stay the course. And so that's another reason for community in this palliative parenting.
I also term it, I kind of phrase it to myself, palliative permission, because sometimes it's not the expectations or the thoughts of other people, it's what we struggle internally with ourselves. And so we go a lot into this in our palliative parenting course about two things can be true at the same time. We can hold two values equally, but what we're doing is we're choosing our child first and foremost in mind. And so, for example, we can value education and we can also value our children's mental health simultaneously. But when our children struggle, that means that if we put our children first, we may have to make different decisions surrounding education that may give us pause, but the courage lies in the fact that we know we're doing what's best for our child, that increases their quality of life, that decreases their pain and suffering.
And what we're all talking about here is really a big paradigm shift and changing our ideas about what it means to be a parent and to free ourselves from either the expectations that other people are putting on us, freeing ourselves from the guilt that we may experience, because let's face it, a lot of times well-meaning people tell parents of children who have mental health conditions that it's really their fault to some degree, that they're not a good enough disciplinarian, that they don't have a good enough structure, that they don't set appropriate boundaries. And so we're having to let go of the idea that it's our fault, because when we think about it in terms of fault, when we are encouraged by others to have unrealistic expectations, what we're then doing is we are looking at our children's behaviors as something that needs to be fixed or corrected, instead of looking at it as a communication of their need. And in the end, all behavior is a communication to other people about what they need. And when our children are symptomatic, their actions, their words are showing us what they need. And it's not ever that they are saying, punish me. What they are saying with their behaviors is, I need help. I need to be loved. I need to be supported in this moment. And this is a really big shift for people to make mentally around their approach. And we don't want to make it sound as though that's not really truly significant. It is. And a good portion of the face-to-face class, as well as the on-demand video course, is practicing these principles in between each lesson, which is why we developed, to go along with the course, a workbook that takes you through each week lessons in learning how to reframe our thinking, in learning how to approach our children and their struggles differently, in learning how to rethink our assumptions about ourselves and our children and our job as parents, and really how to re-engage with our child in a way that makes them understand that they are our priority. So it's a really big shift in terms of how we think about our role as parents. And so, we have a lot of abstractions that we've talked about, and I'm hoping that we can concretize it a little bit with some examples of how we use palliative parenting in practice. And so, I'm going to start this by talking about an experience that I had with my own child, where he had to do an internship for school. And this meant that one day a week he was not going into the school building. He was instead going to an alternative location to do an internship. And he had an internship that I thought was wonderful, but was very, very stressful for him. And so I had to put aside my opinion of his experience and instead embrace what his experience of it was. And his experience of it was that it was extremely stressful and anxiety provoking. And one day, a couple of months in, I had been watching his anxiety sort of escalate and him telling me, no, I can get through it. No, I can get through it. And then one day, while I was driving him there, he became so anxiety ridden that I was afraid he was going to have a panic attack right there in the car next to me. And I pulled over and I said, are you okay? And he said, I don't think I can do this. And there was a little voice in my head, remembering, perhaps what would have been said to me when I was his age, that no, you've made this commitment. This is your responsibility. This is an obligation that you agreed to. You have to do it. I know it's difficult, but if you muscle through all of the things I'm sure we can all come up with a half a dozen of them as to what a parent maybe would say in that circumstance. But the palliative parenting approach showed me that in that moment, it was to see that my child was in distress, and that the most important thing I could do was to help him not be in distress anymore. So we turned around and went home. And I helped him to figure out how to communicate to his internship advisor that this was not working and that he needed to try something different. And because of the advocacy that we had done with his school, his advisor was more than happy to come up with an alternative internship for him that would work better, which we did. And so in that moment, it was recognizing what matters most here is my child's state of being, and forcing him into a circumstance that was overwhelming, stressful, anxiety provoking, doesn't build character. It just makes him not trust me and the world. And that's not my goal. So as a palliative parent, I said, okay, we're going home. So that's one example. Lisa, could you share an example?
Sure. I am thinking about early on after my daughter was, in her case, she had a big behavior change around the time she was 10. And so shortly after that, we're still trying to carry on as normal, and Thanksgiving rolls around. And this kid, we tried to just do Thanksgiving the way we'd always done Thanksgiving at my family's house. And so we're trying to ask her to sit at a big long table with a lot of guests, even though she is very, very anxious, and the place was hot and she's heat sensitive, and I'm just trying to make her conform, right? Trying to make her do what kids are supposed to do at Thanksgiving, which is sit at that table and say something that they're thankful for. And instead, what was happening is that she's tugging at me and whispering in my ear and making me go out of the room. And at one point, we finally went to a different level of the house, and she's like very near meltdown. And, I finally decided that we had to go. We just couldn't stay anymore. And so had kind of an awkward departure. And it was a really unfun Thanksgiving for both her and myself. And then Thanksgiving rolls around next year, and I'm like, yeah, I don't want to do that again. She can't do Thanksgiving the way we do Thanksgiving. It doesn't work for her anymore. She doesn't have the capacity to sit at a table and talk to a lot of people when she is so uncomfortable in her own body. And so we're at my husband's family that year, and instead we did all kinds of things differently to try and parent palliatively, to try and raise the quality of life, not just for her, but for all of us. And so I called ahead and I talked to my sister-in-law, and we made a plan. And my sister-in-law created a space for my daughter in a different room away from where everybody else is eating. I made her a plate first, and I brought it to her. The room was cooler. It wasn't in the hot room where the food had been made. And then we had cousins go and visit her in ones and twos, so she didn't have as much stimulation. We had driven separate in 2 different cars so that my husband and my other children could stay if we had to leave early. And we were only there, I think, for maybe an hour and a half to 2 hour stops before we left. And it was a completely positive experience. And everyone was just pleased that she had come at all, and that she stayed, and that she engaged as she could. And so we adapted the situation to what her capacity was, and it benefited everyone in the situation.
Jen, how about you? Do you have a concrete example to share?
I have lots of them, but I was thinking going the opposite end in terms of advocacy and medication, and as a palliative parent. My child was always, he considers himself very athletic. And one of the medications originally that he was on, he gained a lot of weight, and he no longer felt that athletic kid that he knew he was on the inside, and he was starting to lose confidence. And medication management, I know, is one part of the overall management of this. And I really needed to step up and to be able to ask for something different. And his doctor was really hesitant, but I said to him, but my child is losing out on his childhood. He's losing out on these important experiences. And that is more important to me. So we have to do something different. And so we looked at it from a palliative approach about what would bring him improvement in quality of life, and the side effects. And so we chose a different path forward where weight gain was less of a risk, because that is what mattered to my son, so that he could participate, so that he could run and he could do all the things that he wanted to do.
We're really all talking about there's this expression, you don't prepare the road for the child, you prepare the child for the road, which is the antithesis of what we're all talking about, right? We're talking about recognizing that providing our child with accommodations, doing things that meet our child's needs actually is what prepares them to be able to go out into the world, and function in the way that they want to. That really allows them to put their best foot forward. Danielle, do you have an example, a concrete example of palliative parenting that you'd like to share?
A lot of the same situations that you guys have talked about, like taking two cars, pre-planning for things like that. But I did have something that I thought of that kind of felt good after we had been doing this for so many years. My child, obviously, I had mentioned that, we had to take him out of school, and then we had to go through a whole process with that, trying to figure out the best way to school him, because not every homeschool situation is the same, so there was a lot of back and forth with him about that. We tried a lot of different things until we settled on the thing that worked for him. And then when he was home, he had made like a group of friends online that he played games with, kids his age. And one day I was standing outside of his bedroom door, and I was listening to him palliatively speak to this friend group who was having like an argument on the game. And then, he came out and he was like, I just had to de-escalate one of my friends. And I'm just, this is a child who, just 5 years prior to that, I was told couldn't function in public, couldn't have friends, like was never gonna get better. And now in the way that we model, they do learn. He's like using these conflict resolution skills and collaborative like problem solving with his friends while they're building video games together. So it's not a specific time it worked, it's just confirmation that the message has been received and he's using it too. So,
and it's a great example of what we were talking about at the beginning, that over time, by using our relationship with them as a tool, change does happen. And they are able to learn the things that as parents we want them to learn in the long term. They're just rooted in the fundamental knowledge that we're there with them to support them and to help them throughout everything. We are just about out of time for today, so I want to make sure I get to one last question here that came in, which was about how to access these resources. So Children's Mental Health Resource Center is a virtual online organization. And as you may have been able to tell from today's presentation, all of us, from our dedicated board to our expert staff to our enthusiastic and committed volunteers, everyone here is someone who has the lived experience of having a child or a family member who has a mental health condition, a mood disorder, or the like, and that we combine that lived experience with expertise, education, and professional knowledge to bring a real intersection of compassion, empathy, and information to all the people that we work with. And so we do have programs and services that are available online that are face-to-face, like our face-to-face palliative parenting class, which starts next week and runs for 9 weeks. After that, we'll have another session that begins in January. Or you can access the palliative parenting course through our on-demand self-guided video course, which you can get access to through our website. So any of your needs that you may have, you can look at our website at www.cmhrc.org and get information on how to access all of our programs and services, from palliative parenting to book club to our professional discussion groups and more. We have these live free webinars every month on different topics for families and professionals. And every month we have a clinical seminar, which anyone is welcome to attend, but the material is geared towards mental health professionals, so it's a little more complex. And next week, Jen and I will be hosting the first of a 2-part clinical seminar on the limbic system, which absolutely ties back to what Lisa was talking about earlier today about the prefrontal cortex and the frontal lobe and problem solving and planning and all the rest, where Jen and I will be talking about how the limbic system influences dysregulation, and how when we understand the role the limbic system plays in dysregulation, we can use it to our advantage to help with de-escalation and re-regulation. So we hope to see you all there. That is also free. If there are any other questions, you can reach out to us at admin, ADMIN, at cmhrc.org, or through info, INFO, at cmhrc.org, and someone will be able to answer your question and direct you where you need to go. If you need a certificate of attendance or completion for being at this webinar tonight, tomorrow you will receive an email from Zoom with a link in which you can request to have a certificate prepared and sent to you for a small $5 preparation fee. And if you're interested in learning more about palliative parenting, which we hope that you are, to expand our community, you can get more information, as I said, on our website about either the face-to-face or self-guided courses. So that is it for tonight. Thank you so much, Lisa and Danielle and Jen, for being here, for talking about this important new approach in parenting. Thank you, everyone, and have a great night.